watching Health Reddy with Dr. Reddy, episode number 4. And this is the final episode of our run. And we're shooting this in a very different space. Looks cool, huh, Dr. Sakif?
Yeah, so cool. This is very different from the last 3 episodes that we shot. The setting is different and I love it. So hi everybody, welcome to today's show. The first 3 episodes we spoke about health, wellness, we spoke about stress, we spoke about sleep, we spoke about rest and restoration, we spoke about weight loss. So this umpty number of exciting topics that we have covered, set context for today's topic. And today we'll be talking about exercise, which is one of the most important pillars for health and wellness. And it is apt to talk it because now we are talking about performance, we are talking about wellness, and we're talking about fitness, and we're talking about exercise.
If you've yet watched the first 3 episodes, we highly recommend that you watch them first. Now, you can watch our videos on YouTube or from our Facebook page, which is fb.com/HealthReadyShow. And not only do you see all the videos that we have there, but exciting contents and articles to support you in your health journey. So, Dr. Reddy, we start off by redefining wellness. We explain the health challenges, and in the last episode, we talked about food and nutrition. So today, we're going to talk about exercise.
Yes.
And we have a special guest, and she is a fitness instructor and a competitive cyclist. How about that?
Yeah, that's. I mean, when you said that she's coming on our show, I was like, wow, she's a very inspiring woman. Very active in the local circuits, very active as a personal trainer, and she's got lots to share as well. So, looking forward to get our guest on board and have a rendezvous.
Yeah, have a great session. All right, so with all that, okay, we'll see you for the next set where we dive into the world of fitness and exercise. Hey, welcome back to Health Ready with Dr. Reddy. In this episode, once again, we're talking about exercise and fitness. So, let's go. This is your favorite subject, right?
Yeah, it is. And as we all know, exercise is one of the pillars for fitness, for health and wellness. And the other pillars are diet, food and nutrition, and sleep, rest and restoration. So, these are the 3 main pillars for health and wellness. So, we can't really talk about wellness without talking about health and fitness.
Yes. Indeed.
Okay, so let's go into it. So what are the most common exercises that people do? And we get asked a lot of questions about exercise. In fact, when anyone talks about weight loss, the first thing that comes to mind is eat less, exercise more.
Okay, is that a myth?
That is a kind of a myth because
Right.
Eat less, exercise more might not be sustainable in a long run. Of course, portion control is important, but when you exercise more, your expenditure goes up.
Yep.
And when you are in constant deficit, you have malnutrition, you have other cravings that come in and stuff.
Yes.
So there are better ways to do it. We'll talk more about it we've spoken about some of the strategies in the previous episodes, and we will cover some more in this one. So we, of course, in any health or weight loss or even staying in a healthy weight range, maintenance part, 85% of it comes from food and nutrition.
85%,
85%.
from food and nutrition.
So 15%, of course, comes from exercise and movement. Some movement is better than no movement.
Right.
Okay. So in this episode, we will talk about some of the common sports and exercise that one could kind of do or be involved in to kind of get your metabolism up, to get healthy, to get more fitness and other benefits of exercise as well. So let's start with one of the most favorite ones for Singaporeans, which is running.
Yes.
So running
anybody
is-
can just put on a pair of running shoes and just run.
put on a pair of running shoes and you're off. You get a good workout. So the first question that you need to ask yourself is, do you enjoy it?
For me, not really.
Yeah, so I initially, before I had all the context about the different sports and different exercises. Even I started off running. So running is a gateway for many people.
Yes.
It's a gateway exercise. It gets people moving, walking, and then running. These are two gateway exercises. So do you enjoy it? If you enjoy it, then that's for you. But if you don't, there are many more options that you could enjoy and have fun and exercise. So you don't have to force yourself to go for a run or anything.
I think the word force is like once it's forced, it's no longer fun.
Yeah, that's right. You feel like you don't have a choice.
Yeah.
So that's first thing. Do you enjoy it? The second one, start slow and build it up. So if you're like trying to get into a habit, don't try to get a 5K or a 10K on your first day. Yeah, there are people. It's not
Yes.
funny because there are people who
Yeah.
try that, and then after 2 sessions they just burn out.
They burn out, yep.
Yes, that's right. So I think when you get into a new habit, it's important that you think about long term, you think about sustainability. So it's important that you start slow and build it up.
I think
so.
our guest last week, he did talk about starting off with simple walks. He walked his son to school and
Yeah,
back.
yeah. Yes, I think Max
Max did
spoke
it.
about it
Yep.
really well, and that's why I said he was like a blueprint for starting a new habit. That was a very good interview. If you haven't checked it out, check out our episode 3. Some very interesting conversations with our guest there. So back to running. So once a week, if you're starting off running to get fit, once a week should be how you should start. Maybe 30 minutes once a week.
Yep.
Try to do that for about 2 or 3 weeks. Keep it consistent. Just don't force yourself. Once a week, 30 minutes. Then after 2 or 3 weeks, then increase it to twice a week. Then after 2 or 3 weeks, then increase it to thrice a week. So all along, keeping 30 minutes as your constant benchmark. So you're not varying the time or the intensity, but you're just trying to build a habit slowly. So that kind of gives time for your body to get used to it, get used to the activity, and it kind of gets you in a better position to avoid injuries.
Yes.
Because when you try things too fast and when you try to push yourself, the chances of injuries go up as well.
Yeah.
So that's important that you take care that you don't get yourself into positions where you get injured.
I think rest and recovery is very, very important. Okay?
Yes.
You know, if you like want to run like 7 days a week, you know, you probably lose it all.
Yeah, and yes, if you've conditioned yourself to a point where your body is recovering really fast, then you can do 7 days and then take a break. But if you're starting off and you're not like really conditioned in that athletic mode, then I would suggest go slow. Go slow, take your breaks, give like ample number of time for your muscles and body to recover before you hit it again. But it's all about long term, it's all about sustainable. So then the next thing is running is always fun when you do it as a gang.
Oh yeah, definitely.
Yeah, when you do it as a group, you have a social element, you have a community element in it, and it's a lot more fun. You laugh, you click photos, like how Max
Yeah, he
did,
did
right?
well.
So it's quite fun when you do it as a group. So that's another thing. One other thing that most people miss out is on the shoes. It's
Shoes.
Yes. So one of the main reasons for injuries in running is poor shoes. Are not the appropriate or the right shoes for running. So get your feet tested. There are many running studios. In fact, many of the popular brands do offer like kind of gate-based running shoes, which you can, if you're a flat footer, you have a separate set of shoes. If you are someone who's got a more like higher arch, you have separate type of shoes. You like barefoot running, you like heel running, support. So there's many varieties of shoes that you can choose from, but you'll have to choose the shoe that's specific for your style of running and for your activity, whether it's running long distance or whether it's running short distance. Okay, so that's something that I think a lot of people miss out. And the last but not the least is patience.
Yes.
Try not to rush things. Go slow. Think about, are you going to be doing this for 1 year? Are you going to do this for your life? So you got ample time to ease into it. You have ample time to enjoy yourself. You have ample time to exercise. So these are things that you could follow to kind of have an injury-free and a very healthy exercise life. Exercise as part of your routine. The next thing that popular amongst a lot of Singaporeans or even globally is strength training.
Yeah, I've seen a lot of gyms popping up, and they're no longer the kind of gyms where you just do workouts, but you have like personal trainers. You got all these funny looking weights and stuff like that.
Yeah, now there's
It's different.
there's a whole dynamic of community and group now. The tribe, they're trying to create the tribe and to make people work out together so that there's other element, not just your body movement, but there's other elements involved in that. So having a personal trainer definitely helps because one, they motivate you. Two, they will correct your posture. They will help you with preventing injuries. Three, they will guide you to your goal. So when you know, if you're a type that is really driven and really focused, goal oriented, I'm sure you can go at it by yourself. But if you're someone who likes to like get some help, get some nudge, then I think starting off with a personal trainer is really, really good.
I like the idea of a tribe movement because everybody's doing it. I've seen some of my friends, on social media. They put up all the workout on the board.
Yeah.
And everybody will be like taking it off one by one.
There's a kind of a healthy competition there as
Yes.
well. And it's like fun, and then they compare, they share on social
So
media.
everybody's like just pushing each other.
That's right. So
to
that
better
element
price.
is catching up. So strength training doesn't have to always be, say, like just pumping weights
Yes,
or powerlifting. Those are the traditional forms of strength training. But now there's more forms that are involved, like even things like HIIT trainings, like calisthenics, like body weight trainings
And squats.
and squats.
Yep.
There are many ways one can do strength training, resistance training using bands, using ropes. So it's just finding what suits what suits you and what you enjoy, what's fun to you, and what it does. The advantages for the strength training is it improves body composition. It helps you build muscle. So cardio, on the other hand, aerobic exercises don't really help you cause muscle bulking or cause like kind of muscle strengthening. They are more to improve your metabolic and aerobic flexibility and aerobic capacity.
Okay.
But strength training is the one that really helps you to shape up and tone up. So I think that's where strength training has gained a lot of popularity because it gives you a good overall physique and aesthetic. So that's one thing. And the other one is it also improves your cellular metabolism and boosts weight loss. Okay, so a right mix of cardio and strength training is ideal.
Right.
But I guess if you're doing strength training to start off with, it's a perfect gateway as well.
Okay.
It doesn't have to be in the gym. You can do it at home with no equipments at all. The other one that's also famous is, or rather popular, gaining more popularity now is yoga.
Oh, this is my thing.
Yeah, so you do yoga too,
Yes,
right?
I do yoga.
Yeah, so share something about how you got into it. and-
Okay, the reason why I moved into yoga because it's like I don't like to run, and I've got maybe carried too many injuries from my past sporting experiences that has accumulated over the years. So
Yeah.
I do yoga to actually keep fit and actually just to have a bit of flexibility in my body.
Yeah.
So, and I really enjoy yoga because if I lead I lead a pretty much a busy lifestyle, so yoga sort of like calms me down and really put me into into the moment. So that's why
That's
I
so
really
true
like,
because
enjoy
yoga does have that relaxing effect
It
on
has.
you. So there is a lot of evidence that yoga will switch you from a sympathetic to a parasympathetic mode, like kind of a de-stress mode.
It does.
Yeah, so that kind of helps you calm your nerves
Yeah.
as well.
And initially I thought yoga is like, it's easy and everything else. My goodness, when you hold that pose, is actually, there's a lot of strength involved in it as
Yeah,
well.
it's. I mean, as I said, there are many modalities of yoga, right? So there's simple ones and there are more complex ones
Yes.
where you hold asanas and all that. But overall, I guess yoga hits many dimensions. It helps with aerobic fitness.
Yes.
There are the hatha yogas and all where you do a lot of aerobic movements. Then it also helps you improve your core. It also helps you with strength. So there's a little bit of resistance as well. It helps you with balance.
Yeah.
So it kind of helps you with multiple levels of fitness.
Yeah, so don't be fooled that yoga looks like, it's easy peasy. No, it's not.
Yeah.
Okay?
So I guess if you're recovering from injuries or if you are kind of getting from a very sedentary state to a place where you want to have a more sustainable thing, yoga is also one of the good gateways, where it allows you the flexibility to do it at your pace, your intensity, and do it the way you want. You can choose one of the styles of yoga and then go with it.
Yep.
So that's about yoga. And of course, there's a lot of sports like swimming, like tennis.
Okay.
And I would like to mention about swimming because swimming is one thing that I guess even with injuries, you can still swim.
It's low impact.
Yeah, it's low impact. And the thing is, it's a lot more cardio. If you're swimming fast or you're swimming slow, there's still your whole body gets a workout. Multiple muscle groups get activated. At the same time, you're not really putting impact. You're not weight bearing. We call it non-weight bearing. So even if you're a runner and you're a cyclist, you've had injuries, you can still swim.
Yep. I know a lot of sports people out there, swimming is the choice when they're doing their rehabs.
That's right.
Yeah.
That's right. So that's one of the reasons why, because it kind of takes the weight off the injured muscle group or the body part. So I guess swimming is a very good bridging kind of activity. Then there's more about like team sports, like football, like basketball, like cricket, and like baseball, rugby. These are all sports that have an element of community in it. They have a lot of cardio, aerobic element because there's running involved, there's movement involved, and at the same time, there's also kind of specific movements involved. Like tennis has arms and shoulders and upper body, core strength. Then there's same thing with football. There's running involved. There's different elements that come in there. But there, it's more about community. It's more about playing the team game.
Yes.
So that element comes in there.
When I used to play football, it's always the part of like having the drink session after the game.
Yeah, that's very important, right?
Yes.
As a team, you go out and you have a drink session. You had supper, and it's really good. And I used to enjoy my time sporting in my university as well.
Oh, okay.
We used to have our basketball teams.
You
And
used to play basketball?
we used to play basketball, and it was a good thing. It was that was the way I kept fit when I was in college. Now it's different. I've moved more towards training by myself. I do a lot of calisthenics. I do CrossFit. So
I
that's
think one of the challenge of playing team sport is like, you have to get everybody together. For example, football, you need like 11 people.
That's right.
And an opponent and a referee and a pitch.
That's right.
So they've come up with the 5-a-side, the futsal.
That's right. That's one of the limiting things for team sport. So how we went about that is we joined clubs. So I used to play for a local club. So because the club always used to have people
supply.
practicing,
Right.
and there used to be games going on. So we just go to the club and then just there's a game there. So that's one way you can keep team sports going. Okay. The other one which I'm more involved now is CrossFit.
This is your gig.
Yeah, this is right now my thing where I like to do body weight exercises, and I like to combine that with weights, dumbbells, kettlebells.
Do you do it at home or in the gym?
I do it at home.
you do.
I try to do it at gym, but with my schedule to pull out time to go separately to the gym, I found it a little impractical. So I just use an app on my phone. Nowadays, after the COVID, I mean, there's lots of resources online. So I just use the app to exercise and do it at home. And it's really helped me shape up. It's helped me move my habit to a next level. So I'm really glad with that. So because CrossFit has both strength and cardio elements combined, so it works really well. Then we've been talking a lot about cycling of late.
Yes,
Yeah,
correct.
and even our guest today is a competitive cyclist.
Yes.
And even our episode 1, our guest was a cyclist. So there is a lot of spotlight on cycling. And it's one of the favorite sports. I cycle once in a while. I have my cycle. I go to the East Coast Park.
And during COVID-19, it seemed to have like suddenly spurred out every there was a lot of cyclists on the roads. Do you notice that?
Yeah, there is. I mean, weekends when I go to ECP, there's a ton of them cycling. I mean, I don't know whether they're recreational or but whatever it is, it's getting people out. So I'm really happy to see people active and people moving about, exercising, and it just is a good feeling when you see people getting conscious about health. So cycling is one great exercise for aerobic fitness. It's more on the cardio side. It does help you a little bit with your core as well, but there are some ups and downs with it. Posture is important. If you're especially using road bikes, make sure that your posture is right. Do some exercises, warm up, warm down, strengthen your core.
And also a proper bike fit as well.
That's right. So there are a few things that you need to look out. I think in our first episode we did ask the guest. The guest does. He advised on what are the things you could look out for in terms of cycling.
Okay.
So that's one. Martial arts is the other one, where mixed martial arts, Muay Thai, BJJ. These are other ways one could keep fit. They are more on the strength side. There is an element of cardio as well there, but it's more on the strength and isometric.
And what I can really relate to this is, it's like, probably with so much pent up frustration, everything else, giving a good whack and everything else.
It's an amazing stress buster. It's an amazing stress buster. You take out your frustrations or anger
not
from
on the opponent, but on the bags and
yes, that's right. I mean, if you're doing Muay Thai, you have the bags, right?
Yeah.
So when you punch, when you kick,
Yeah.
you do feel good. I mean, it's something that I've experienced. I've trained in Muay Thai for a while, and I really enjoyed the process too. So that's again, it's also got a group element to it because we train as a group. Yeah, they do have group classes. Now with COVID, I think things might have changed a little bit, but there is a group element as well. So the most important part of exercise and fitness is sustainability. To find the right amount, what's right, suitable for you to keep the habit going for longer. I think that's important. And how do you keep your exercise going on and on is by using the right technique so that you prevent injuries, right? If you're injured, then you get a break, then you lose the momentum that you
Totally
gained.
can relate.
Yeah,
Yes.
so I think that's very important that you pick up the right technique. Whatever sport you've taken, whatever exercise that you're doing, pick up the right technique and always make sure you don't get injured.
Yeah, I'm speaking from my own personal experience. There was one time, I was like, scaling Bukit Timah Hill almost every other day. It came to the time that I got injured and I couldn't do it like for a couple of weeks and I lost it all. So yeah, you're absolutely right.
Yeah, it's a sad thing because you build up the momentum, you're having fun, and then when you push it and then you get an injury, then
I
you just
push myself too much and that's it. No,
yeah,
it really
I mean, I think that's
screwed
quite
up for me.
common. A lot of people go through that cycle, and it's just a matter of finding that sweet spot where okay, so this is the pace I'm comfortable with. I know I can push it up a little bit.
Yep.
And I do that gradually. Not push it up to a point where you get injured and then you are off shelf.
Yeah.
So that's important. But well, now you're back to working out, and then you get back gradually, and then the life goes
bit by
on.
bit,
after
everything else.
that.
Yeah, comes with it.
So the other things, as I said, optimum nutrition is key to performance.
Yes. We're combining what we've talked about last week and this time.
That's
round.
right. So what is optimum nutrition for sport? Everybody has a different body type. Everybody has a different metabolism. Every sport has its own nutrition. Every sport has a different nutrition demand. Some sports, like as you said, that need a high energy burst, like marathons and endurance sports, they do really well with carbs, carb source of energy. Whereas some things like CrossFit and more of resistance training, they do really well with even keto and protein kind of food. So it really depends on what sport and what's your body type.
Okay.
Like I do really well with keto exercises because I'm trying to move my body source to a more fat protein based source. I switched from carbohydrate. So I do really well when I take a good protein meal and then work out.
Okay. What about for those people who does endurance sports on certain days and carry weights on certain days? Do they change their diet a bit?
Yes, they can. Because as you said, when they're doing endurance sport the night before or the day before, they can have a little bit of complex carbs in their diet, not sway away a lot from their usual healthy whole food diet, but add more of a complex carbohydrate the day before. And then on that day itself, they can go back to eating whatever they want to eat. Yeah, but the day when they're doing an endurance sport or activity, they can afford to take more carbohydrate source because they're going to burn it out. Subsequently, when they're doing more strength, they can restrict that.
All right.
Okay. And yes, the most important part of assessing performance, I don't know if you've heard of VO2 max, which is a way we measure the oxygen consumption when we exercise. What that gives is it's measured using a special test called VO2 max test and a lactate threshold test. So these are two tests that we use for athletes to basically know what's their capacity of work. So whether are they going to excel in endurance sport? Are they going to work well with maybe other kind of sports like strength training and other stuff? So it just kind of gives you an ability or an insight into that. So it's one of the things we use to assess your fitness levels. So that's something you could get from any sports clinics or any fitness centers. Some fitness centers offer it, but I think most sports clinics offer it. Then the other thing, which I think we've spoken about in the previous episodes, is blue zones.
Yes.
Do you remember?
I remember that
Yeah.
one.
So blue zones are areas around the world where people live above, like a lot of people live above 100. So these are pockets around the world where people can live. Many centenarians are concentrated there. So what is their secret? What is their exercise secret? They are active.
Ah.
They,
Okay.
These people, I mean, they don't go to the gym, but they are active. They walk a lot.
Right.
They go farm a lot. They garden. They do a lot of physical activity.
And probably spend time outdoors.
That's right.
Beautiful
In
lakes,
the sunlight.
mountains, right?
Yes, that's right.
Nature.
They go climbing and all that stuff. So there's that element of activity that played a big role for them to live that long. So exercise, it doesn't have to always be in the gym or doing a cycle or with equipment. It can just be walking around doing your own work. So that's one of the secrets for blue zones. Of course, they have other things like healthy whole foods. There's an element of community. There's nature. And then there is adequate rest and sleep. These are the other secrets that led to people living more than 100 in these areas. So these are lessons which are very well captured by the author in books called Blue Zones. So now there's one myth that I really want to address because it keeps coming up again and again, which is about protein.
Right. Protein.
Yeah. So protein, how much protein should one eat? So any idea?
Well, adequate. Maybe out of 100%, personally, I'll do about 30%. About
of your total
out
energy
of the
intake.
100%.
Yeah. So close by. So everybody's protein intake should vary based on what their demand is. But I guess if you're eating a well-balanced diet with healthy amount of fats, healthy amount of proteins, and healthy amount of carbs, you don't need to supplement it with additional proteins. Of course, you're going for competitive bodybuilding and you really want to bulk up, then you might need to take an increased amount of protein, which again you can get from natural whole food sources. But if you find that you don't want to eat so much meals and then you want to just take it in very compacted form, then you take like supplements of protein. But that's not for everyone. And most people should stay away from taking excess protein because it can lead to inflammation and it can lead to insulin resistance as well. Because if you're not going to use up the protein that you're consuming for muscle building, it's going to convert to energy.
Okay, which is sugar.
That's right. That's right. Okay. So it defeats the purpose of doing that. So it's very important that you try to get your protein source as much as possible from whole foods, from the diet itself.
Okay.
Eggs is a very good source. So eat a lot of eggs if you can. The myth that eggs are bad, the yellow of the egg is bad.
Yeah.
Forget it.
Yeah, we talk about it in
we've spoken about it in the last few episodes. Forget it. And never forget to give breaks between your training periods.
Very important.
Yeah. So if you're working out 7 days a week, that's okay if your body is accustomed to it and if you've conditioned to do that. But after that, after 7 days, take a break. Take a break 1 day, 2 days, whatever your body feels right. Listen to your body and give that rest and restoration. Sleep is important in a daily basis, but break from your routine is also important because that's a period where your muscle building happens and your body is recovering. So that's important as well. So some of the supplements that most athletes take, I just want to touch on this briefly, is branched-chain amino acids, omega fatty acids, magnesium, zinc, creatinine. These are all things that which enhance performance to some extent. Caffeine or coffee also enhances.
So this is something extra on top of the whole foods that
That's right.
eat.
That's right. This is I'm going into the spectrum of performance now. I'm trying to see how do you optimize beyond the whole foods.
Okay.
So you have to get the basic right first before you go into supplementing. So supplements are on top of a background healthy diet. So I think that's what we cover into sports nutrition. So protein and all that come on top of the normal diet. Hydration is key. So drinking water is essential because it's key for cellular metabolism. It's key for recovery. It's key for even getting good sleep. How much water do you drink? Because everybody says drink enough. A rough guide would be your body weight divided by 20.
A body weight divided by 20. Say, for example, a person who's weighing 80 kg.
Yeah.
You buy 20, that would be
Would
4
approximately
liters?
drink 4 liters,
4 liters,
a
alright.
day. That would be what would be required for his physiological function.
Mm.
So those are things. There are other things that many athletes do train, like training high and training low.
Oh, what's that? Training high and training low.
So training high is when you are training after you have loaded with carbohydrates. So you basically say eat a high carb, complex carb diet, and then you train. Like you eat the night before, the next day you train. Or
So
you,
it's an intentional meal for the next day.
that's right. You're intentionally eating to load up energy for training.
Okay.
Training low is training fasted or training with low carbohydrate foods.
Wow.
Yeah, so that kind of switches you into a more adaptable, flexible, like it kind of puts you into burning fats because you've used up all your glycogen carbohydrate sources, so you're tapping onto the fats now.
The stock value that we have.
That's right. Yeah, so a lot of athletes nowadays, the endurance sports, there's a whole bunch of them who are strong advocates for training low, who believe that, training low is the best way to do endurance sport. But there's frankly no right or wrong.
Yep.
For some people,
Agree.
training high works really well. For me, training low works really well. I train low a lot.
Yep. And I
And
think
a mix of both works
yeah,
really well
for
too.
me, I did the training low bit because like before I hear you saying training low,
Yeah.
I did go on a workout on a keto diet, and it did not really work for me.
Yeah.
Yeah, because my blood sugar was like way down and everything else.
Yeah, I remember you did tell me that your blood sugar goes down to really
Really
low
dangerous level.
levels when you train low.
Yeah.
That's not healthy either.
So yeah.
So you just have to find out what's the balance for you. So that's about it. So most importantly, eat organic. Some quick points about optimum nutrition for best performance. Organic sources of vegetables and fruits will help you reduce the inflammation and keep you more active. Sustainable wild-caught meats and grass-fed meats are much better than shelf farm-fed meats. Antibiotic and hormone-free meats are better. Ethical farming practices are key for sustainable food sources. So these are things that we've covered briefly in our previous episodes as well. We're just putting the spotlight here on that. And one of the other things that I thought was important is about nuts.
Nuts, okay.
People like to snack when they're hungry or
Right.
when their energy levels go down. So nuts is a good source to do that.
There's more than just the snacking.
That's right. There's healthy fats in it. There's proteins in it. There's other minerals like magnesium, selenium and all that, which also help your body functions.
And what would be the type of nuts? Because there's so many nuts.
That's a good question because it's low glycemic nuts work really well, like macadamias, like almonds.
Yep.
They work
Almonds.
much better than pistachios or peanuts or cashew nuts, which are high glycemic nuts. So
Okay.
just choosing the nuts is also important, and not too much, but at the same time they add a good source of bridging energy. And last but not the least, we want to talk about fasting and intermittent fasting.
Yes.
We've covered about intermittent fasting in the previous episodes as well. In terms of exercise performance, what fasting and intermittent fasting do, it's similar to training high, training low. It's more towards training low, where you become more keto adapted, where you start to tap on fat for energy rather than carbs. So I think it also helps you with weight loss. It also helps you improve your cellular metabolism. It helps you body to recover autophagy and stuff like that. So there's a lot of exciting research going on globally for about fasting and intermittent fasting, the benefits of it on athletes, and we will get to know more. And so we will share more in our future episodes. So I think these are the key points that we wanted to shed light on in this episode. And I'm really excited for our guest who's coming up next. And I want to see what she has to share.
All right. So coming up shortly, we're gonna have Miss Christina Liew, and she's gonna take us through her job as a fitness instructor as well as a competitive cyclist. Stay tuned. welcome back to the show. This is Health Ready with Dr. Reddy. Now, the next set, this is where we have our special guest who will be sharing her expertise with us. And since this episode is all about exercise and fitness, we have a specialist fitness instructor. Her name is Christina Liew. Welcome to the show, Christina.
Thanks, Walter.
Now, Christina, I understand that apart from being a fitness instructor, you are also a competitive cyclist.
That's right.
Would you like to tell us more about your cycling career?
Started about 15 years ago, just cycling around, and then got roped into racing. So, and ever since got hooked onto it.
And okay, I understand that you actually travel around the region.
That's right.
this?
Well, the races usually will be within the region, like Singapore, Malaysia, the Southeast Asia. But I've raced in Japan and also Australia as well.
Okay, is there a team that you're representing?
Yes.
So a special shout out to all the
That's
teammates
right.
out
Yes.
there.
Yeah. That's right. I'm with the Matador racing team.
The Matador Racing
That's
team.
right. A great group of people, which is we
So
have
I'm
lots
just
of
curious,
fun.
what cycles do you use?
Road bike.
Road bike.
Yes, mainly road bike. But our team also, some of the team members actually do mountain bikes as well.
I see.
And yeah.
But
Yes.
do you prefer a certain cycle, like a brand, or you customize it, or you?
Yes, I go for the trek bikes. That's my preference, and but there are a lot of other brands out there. So usually, I think whichever you prefer, and most of the sort of bikes are actually quite good now.
Okay.
Okay.
Yes.
Now I do know that pre-COVID, I've seen a lot of groups of cyclists out there, moving out as a group. Where do you ride normally in Singapore?
In Singapore, because Singapore's obviously quite limited, so it's either the east or the west.
Yes.
And pre-COVID, we can ride with anyone or as big a group. But now, it's wise to just limit to the 5 people. And if you meet another group on the road, we should actually hold some distance as well.
That's good. Yeah,
Yes.
everybody should be looking out for
Yes,
each other.
I agree. Yes.
Yeah. Okay. So, do you meet up before the ride? I know some people meet up and say, for a bit of prata after the ride and stuff like that.
Sometimes we meet before the ride at a coffee shop, a couple of us just for a drink. And then we basically set the time and then we'll ride. And then after it will be coffee and breakfast and chit chat.
So it's usually a night, because I know a group of friends who start off late night, and then they cycle all night, and
Overnight?
then breakfast they have it in usually go to Kranji or Salita or somewhere like that. They have breakfast and then they cycle back.
That's right. Yeah.
Yeah, so I don't think it's probably 5-6 hours or more than that.
Yes. Yeah. So I mean, some people would do the overnight one because I suppose during that time the traffic is actually a little bit better, and less cars.
yeah.
Yeah. But our team usually meet in the morning around 6:30, and then we'll ride probably up to about before lunch. So we'll finish about late morning, about 10, 11.
Okay.
So it's, usually about 4 or 5 hours riding.
So there's so much to talk with you because apart from being a competitive cyclist, you are also a fitness instructor.
Yes.
Wow, you're really really busy everything else. So tell us more about what do you do as a fitness instructor?
I work a couple of gyms, and I teach. I used to do a lot of personal training, but now I focus mainly on group classes. Yeah, so basically, in a studio with several people at one time.
Okay, and I understand that with COVID-19 and we have some measures kicked in. So is there a limit of the number of students they can do?
Yes, which is true. Depending on the studio and depending on the size of the studio, it will vary from 5 to 10 people as long as you've got the distance between. Yeah, so we're limiting, and even the the number of people that can actually go into the gym as well to work out, though. So that's important as well.
Okay.
So in a group session,
Yeah.
what kind of exercises do we do? Is this something like a hit training?
Yeah, they are HIIT training, but personally myself, I do those the Les Mills body pump, body combat. I do a lot of spinning as well, which is the indoor
cycling. Yeah.
Yes, some
There's music and then there's
yes.
High energy and everything.
yes,
Wow.
and everyone's whooping and having a good time.
good fun.
Yes, that's right.
So it brings up the dopamine and serotonin.
Yeah, so there is a little bit of cardio, plus there's a little bit of even strength isometric kind of thing.
Yes,
so it's
like
kind of a mix, I guess.
Yes, that's true. Yeah, body pump is actually a strength class, which is we use weights.
You use weights, right? Yeah.
Yes, yeah. So it's a good combination of everything.
Yeah,
and
there's
some stretches
music,
as well.
And then there's
So, Dr.
Yeah.
Reddy, what do you think about the nutrition that people should look into when they're doing fitness training like this?
Yeah, so I said nutrition is as important as when how much we exercise or what intensity we do, and I guess eating clean. What I mean by clean is whole foods. There's a whole school of thought that, oh, you should have all these supplements and accessory nutrition, but I firmly believe that if you're eating well, eating nutritious food, healthy food, I think that should be more than sufficient to take you through.
And
Totally agree.
Christina, what do you think?
Yeah, I mean, I totally agree. I mean, if you've got a really good diet, it's balanced, with all the nutrients, personally, again, I also don't take any supplements. Usually I don't, but if it's for a big race, I will load up. And it's actually not supplements, it's actually eating properly, like loading up on the carbs.
Yeah.
And then after a race, the recovery, making sure I replace all the, the electrolytes, the salts, and the glycogen.
That's an important thing because I guess once you have seasoned as an athlete, the process of that seasoning is also understanding what food suits you best for your body type and for the sport that you've chosen. So then you eat for that whatever the activity is.
Yes, very true. Yeah.
So it's different for different people.
Okay, so for example, somebody in the 60s going out for walks, they have the kind of nutrition plan versus somebody in the 20s, doing competitive. It's totally different.
Yes, of course. It's the energy needs are different. Their metabolism is different, and even the type of sport. Someone doing cycling might have very different nutritional needs compared to someone working out in the gym or someone who's swimming. So they might be variations, but as you said, it's different for each individual, and I think they'll have to discover that by trial and error or by working with a coach or like an instructor or an expert who can guide them through that.
Maybe Christina would like to share about your diet plan.
I usually I try to eat 3 meals a day, and it's hopefully balanced with your carbs, your proteins, and your greens and the fruits. But if we're talking about cycling, I do bring food with me, and what works for me, and I've tried it like trial and error.
Yeah.
It's actually peanut butter and jam sandwiches.
Ooh, I'm hungry.
Yeah, as you said, this is an endurance sport,
Yes.
and she's constantly burning up whatever she eats, so she has to carb load.
Yeah.
So that works really well for the sport that you're in.
Yeah, that's right. And
Okay,
also the
so-
electrolyte drinks as well.
Yeah, I think for somebody else on the same diet, on a lower kind of exercise, lower intensity kind of exercise, that will power as fats.
Yeah, I mean, if they're not going to be expending it or if they're not going to be using that, then of course that's going to add up to their energy reserves. Yeah.
Okay, so Christina, she's the fitness instructor. She's the competitive cyclist. Now, ladies and gentlemen, this is where we have the big review. Her name is actually Dr. Christina Liew, and she's a dentist from Smile Focus. That's why I
That's
look at the
right.
pearlies and everything else. Okay, so we've got 2 doctors in the house. So, doctor, what would you like to say to this doctor?
Well, Christina, I was pleasantly surprised when I heard Christina was a dentist, and then
Alright.
she said, "Oh, there's a lot of doctors and dentists who are into fitness and sports and healthy eating." So that's really, I mean, I'm happy to hear that there's more awareness in the community as doctors and healthcare providers to stay healthy ourselves before we advocate to our clients and this thing. The most, I think, dentistry is one area where you get to see the mouth of people and their early signs of many disease that manifest there.
Yes.
Could you shed some light on what your experience is in looking at a disease perspective from looking at people's teeth and oral hygiene and stuff?
Yes, I suppose if you look at someone's mouth, I mean, first thing you look at usually with the teeth, So if someone's got really, for example, worn teeth or very eroded teeth, sometimes you have to question what the diet's like. For example, if someone turns out a lot of erosion, which is dissolved enamel, they could be vomiting a lot, like bulimics, anorexics. Gums, for example, that are very swollen, usually apart from, for example, people with diabetics or have got very poor healing, so the gums tend to bleed a little bit more. some viral stuff, herpes, and also even osteoporosis can affect the bone support for your teeth as well. So people lose teeth.
Okay.
So these are things you can sort of check out and just maybe advise the individual to get a check, a medical medical exam. Yeah,
That's right. And there's a recent focus on cardiovascular health and heart disease
Yes.
related to dental hygiene or dental health, right?
Yes, gum problems. There's a recent, now it's actually quite known that there's a big correlation between gum disease and cardiovascular disease because I suppose the mouth with all the bacteria in there, the bacteria can get into your bloodstream. And because of the inflammation, can affect the vessels, the blood vessels, can affect the heart, like endocarditis, which is the lining of the heart.
Yeah.
So there's a big correlation now.
Wow, okay.
Yeah.
So you could be like, the dentist could be the first round of defense actually on
They
this.
could
Yes.
pick up, yes. They
Yes.
could. You can identify the risk factors before you actually see the disease itself. So, like if someone's got gum bleeds or poor gum health, I mean,
Okay.
the healthy gums, then you can predict, say, hey, this person, if this one continues, is going to have some risk factors for heart disease down the stream.
Wow.
So you identify and then you kind of intervene, advise, and address that.
Yes. Yeah.
But
that's
any
right.
specific dental issues that have cropped up or increased or
Yeah. One big one is would be actually grinding.
Teeth grinding.
Yes, grinding. Yeah.
Okay.
So
that's
beca-
interesting.
Yeah, because recently in my practice, of me personally anyway, I've seen, especially the last 2 months, for a lot of people with grinding issues, that's very likely because of stress.
Yeah,
And I think that's got a big part to play with it,
the current situation.
Yeah,
and
so-
stuff.
Is
Yes.
it conscious or unconscious?
It's subconscious. I mean, grind. I
Okay.
mean, if you usually a lot of people will grind, but now the symptoms you get would be like headaches. Some people get joint aches, neck aches, and I suppose cracked teeth and broken teeth as well.
That's really extreme, huh?
Yeah, and to
Yeah, because when I've encountered a lot of women who want to look slim, who come in for Botox injections,
Yes.
to kind of reduce the I think the jaw, the masseter, right?
Yeah.
And then to kind of look slimmer. But the actual cause for that might be something else, right? It might be stress, it might be bruxism,
Yes.
whatever the other issues are.
Yeah.
And it's interesting because a few episodes ago we were talking about how stress is often not dealt and it leads to degenerative problems downstream. And this is one great example of how when people are stressed because of all this, whether it's financial, whether it's work related,
Yep.
whether it's COVID or whatever the situation is, the manifestations like say teeth grinding or things like that shows up. But how they go to the GP is, hey, I have a headache. And the GP gives, I mean, most doctors would just address the headache, but the underlying cause might be the stress leading to teeth grinding, leading to headaches. So that pathway of how it manifests, it's fascinating when you just said that the number of patients that you're seeing for teeth grinding has
Yeah.
gone up. I was like, oh, that
Yeah.
makes sense.
It's interesting, right?
Yeah.
Yeah.
Okay, now I'm gonna be really gonna push the boundaries a bit. Okay, Christina, as a dentist, is there one advice that you really wish you can say in the face of all the patients out there?
Brush your teeth, floss your teeth, watch what you eat. Mainly sugar. Yes.
Sugar.
Yes.
Interesting. We did talk about sugar. We've been talking about sugar all
Yeah,
the time.
we've been talking about carbs and simple
Yeah.
sugars, and yes, I totally agree. I think it's the simple sugars and the sweet stuff that kind of are acidic, and I think the bacteria in the mouth further ferment the sugars and make it more acidic.
That's right.
And you had an interesting fact that you shared. I was like, wow, it's the frequency.
Yes,
Yeah. Can
it's
you
the-
share a little bit more?
Yeah,
about that?
it's when you eat the sugar. It's actually for your teeth's sake. It's actually not it's not the amount. It's actually the frequency. For example, if you have 10 bars of chocolate or 10 sweets, for your teeth's sake, we'll prefer you to eat all 10 at once rather than rather than 10 times during the day. So basically it's the frequency that does the harm rather than the amount.
So if you gotta eat it all at once
Yes,
and then
that's
get
right.
it over with.
Yes, that's right.
Oh, there's some
Yeah.
new information that we all can use.
Yeah.
Okay, I'm going to tell this to my kids.
Yeah, and what do you think about brushing after every meal? Is it something that's a practice or
Yeah.
advisable?
Yes, it'll be ideal, but I know sometimes it's unrealistic if you're outside. But what's more important is actually going to bed with clean teeth.
Okay.
So because when you go to bed, everything slows down. That's when the bacteria is most active. So it's usually before you go to bed. Ideally, be 3 times a day or more. But yeah,
Okay.
before bed is the
Won't the teeth
crucial.
just get thinner or something when you brush so often?
Choose a soft
soft brush,
Soft
yeah,
brush.
and don't scrub. Yeah.
Okay, now when we come back, okay, Dr. Christina Liew will be leading us through some stretches. I know a lot of you guys have been working really hard at home, sitting at a desk, in front of computers. So we've got something special for you guys out there with some stretches.
All right, because when we're working at home, because we're sitting a lot of the times, our hips and back get a little bit tight. So one of the first stretch we'll do is to release your glute, which is your backside. So cross one leg over, point the toes to your knees, and all you need to do is just lean forward. Just gradually lean into it. You should feel a stretch right in the backside out there, guys.
Yeah,
Good.
it's a nice
All
thing.
right, so from this position, you can even use this hand to push this leg down a little bit, just to increase the stretch a little bit more. Okay, so lengthen the back, lean forward. Usually we'll do it for 30 seconds, and then we'll release it. We'll try the other side, shall we?
Yep.
Okay, here we go. But I suppose for the sake of this, for time, we'll just do about 15 seconds or so. You can go straight into it if you're sort of a little bit more flexible. The other thing too is also the breathing. So when you breathe out, just increase the stretch a little bit more. Just push down. So this release all this area here.
Yeah.
Okay, good. So we'll progress on to the next one, shall we?
Yes.
Which is your
let's do it.
hamstring, which is the back of your thigh. One leg forward. Again, from the hips, chop here and just tilt from your hip or tip from your hip. Again, breathing out. So you just go as far as you're able to till you feel a stretch in the back of your thigh.
Yeah, the whole part, the thighs,
Yes, true.
feel the stretch.
Good. So let's go for the other leg. So you'll probably find one side is usually a bit more
Tighter?
Tighter, yeah, which is true. Okay, good. Because tight hamstring, so is one of the cause of maybe a tight lower back or an achy back as well.
Yeah, it also
know.
causes hip tilts and pelvic tilts.
That's right, just the imbalance. So you're right. Good. So we'll release this one. So once after you do 30 seconds, you can actually progress onto upper body because of the leaning forward, tight chest. So we'll do maybe a chest stretch. Okay, bring your elbows up by around shoulder level, as if someone's grabbing your elbows and bringing it back and down. So lift the chest and lengthen the neck.
It's
and
like
feel the
hands
stretch.
up.
Yes.
Someone's got you at gunpoint.
Yes, that's right. From here, you can actually progress onto maybe a side stretch. Your hands are up and just sit up tall, maintain your length, and just tilt to the side. You can use this hand to pull. So think about spreading your ribs. So a nice side stretch. Maybe a little bit stiff, and release it. And the other side. Good. All the way down to the hips, though. So these stretches are actually very good for maybe if you're taking a break, if from work and you've got about 5 minutes or even a few minutes to spare, just to loosen up everything though. Okay.
Yeah.
We'll go for the next stretch. One to the side. Just some pressure in your hand on the side of your head. So you feel there. Release it and then you can try the other side. Good. This is a very good stretch. The neck, you've got a very tight neck.
Side of the neck.
Which is true.
I'm
All
enjoying
these
this.
we can just do while sitting
Yes.
in your chair, in the study room, in the office desk, just to get the muscles loose and
Yes.
release some tension.
And then bring your chin to your chest. Okay, just gentle pressure to begin with. Just test it. Sit up really tall and then just feel the stretch here. This is I like this stretch. It's a very nice stretch.
That's me with the double chin.
Really? Good. So you can just release it. Just roll the shoulders a little bit back, just rotate front, back, You can do a back stretch by just separating your shoulder blades, just pulling it apart. So like the pages of a book, just pull your shoulder blades apart. Yep. So you're stretching all in the upper, sort of the upper body. Good. And you can finish off there. Quick, more rotations, and just a few minutes to just loosen up the body and taking breaks between your work.
Yeah,
really.
I really feel so good.
I think that's
That's
a good break from the routine of sitting long hours at the desk, even standing up, taking a walk, doing some stretches. I think a few times a day, definitely it helps the back and the core and the posture.
That's very important.
Yeah.
True. Yes.
Thanks for sharing the quick ones.
Yeah,
It's
and
a pleasure. Really. Good.
Yes, really good.
Now, with that, all right, we'd like to say thank you very much, Dr. Christina Liew, for joining us at the set. Okay, fitness instructor, avid cyclist, and a dentist, all combined into one. What a woman! All right,
Thank you.
Thank you so much. Okay, we hope you very best. We wish you the very best in your future.
Thank you.
Thank
Thanks.
you.
Thanks, guys.
Thank you.
Thank you.
Hey, I hope you enjoyed the stretch brought to you by Dr. Christina Liew. The next part of the segment, okay, we receive on our social media, which is once again fb.com/healthreadyshow, some questions, and perhaps we can take the opportunity to answer some questions.
Yeah.
Okay, the first question is, it comes from a cyclist, okay? He asks, does prolonged cycling lead to poor posture from riding the bike for so long?
Okay, so cycling does have some strain on your back because of the posturing, but that's where it's very, very important to find the right cycle fit. So when you're going to purchase a cycle or even trying to get into cycling, you need to find the right cycle for your fit, for your height, for your body type, and then also warm up, warm down, do some stretching,
Yes.
keep things dynamic, because when you are doing a long endurance cycling races and stuff for a long time, you do have a lot of stress on the lower back that leads to back pain and some issues. But these are things that can be corrected, and it's not a it's not a permanent problem. So
And-
it does not affect posture on a long run.
Okay, and probably one of the things that I know a lot of cyclist friends do is actually they work on the cores as well.
That's
That
right.
means not just on the bike, but probably they take up multi-sports to work on just the core. And
That's
everything.
right. There's a lot of core strengthening as well.
Okay, so the next question, all right, I've got it on our social media, is this question about high blood pressure. Okay, so this is probably a common thing with people who are suffering from obesity. We talked about it in the last episode. Okay, it goes, I have high blood pressure. Is it okay to do HIIT training?
Yeah, it's a very good question, because high blood pressure comes from probably stress, from hardened arteries, and a lot of time when people have high blood pressure, they might have some heart issues as well,
Yes.
early stage heart issues. So I wouldn't really push into aggressive kind of exercises without actually knowing, say, the VO2 max or the fitness levels. So once we assess the fitness levels, then you can decide what kind of sport is suitable.
Right.
But I generally recommend start with something that's a lot more gradual and then up it up as your body adopts to it.
Yeah, because I know HIIT training is like really high. It's high
Intense.
intensity. Yep.
It's intense.
Yep. Okay. So earlier on, we did talk about going for walks.
That's right. Going for
And
walks,
yoga.
swimming, yoga, maybe even like brisk walking should be a good exercise to get in. You can do strength training, resistance training,
Yep.
because that is also you can do it gradually instead of straight into CrossFit or HIIT training.
And I did remember our guest from episode 2, Ross. He did say, "Listen to the body."
That's right. That's very important. That's very key. That's very key.
Okay. One more question, if we can. Okay. This question goes something like this. I've heard mixed reviews on isotonic drinks. Recent reports that I've read have mentioned that it doesn't actually do much. Dr. Reddy, what are your views on this?
Okay, it's a good question given the context that a lot of people have this idea that you drink isotonics after exercise. It's like normal. It's okay. It's like drinking water. So there are few pros and cons to that. Yes, they are very good in replenishing electrolytes that you've lost while you sweat and stuff. But as you said, it's not something that you consume on a daily basis. In fact, I've had clients who have like hypertension and other issues, and they have like cans and cans of isotonics at home when they are not so active either. So I think it's just the way people like the taste or whatever. But if you're like running a marathon, of course, go ahead. Take some isotonics to replenish your salts and fluids, but take them at regular intervals rather than chuck down a whole bottle at one time. When you say health aspects of it, I personally am not a big fan because I try to avoid processed foods. So I rather hydrate or take lemon juice or something along the running way because I take my own drink. But if I really have to drink it, I will. There's no issues. Better than getting dehydrated. Okay. But avoid the ones with sugar.
Right. Read your labels.
Yes. Read your labels. Avoid the ones with sugar. Avoid the ones with additives. Choose wisely.
Yeah, and I've read a couple of labels, and one of the things that they hide sugars in some of the drinks, they put it under carbohydrates. You may not find sugar anywhere, but it's actually hidden in the carbohydrates.
Yeah. So that's something that you can watch out for. So not all isotonics are bad, but read your labels well.
Yep. Okay. So 4 episodes, and we've come to the time that we look back at all the 4 episodes. It's like, my goodness, we have really come a long way. Would you like to summarize for all our viewers out there? All right. From episode 1 to 4, what is the whole transition like for all of us?
Yeah, I had an amazing time. First of all, I had an amazing time shooting for these 4 episodes and also sharing my knowledge with everyone. And Water, you've been an excellent host as well, and
all right,
you got your life experiences into it. You managed to get the right guests on board, so it was an amazing experience working on the team. And this whole experience about sharing about health, about wellness, from episode 1 onwards, where we set the context for health and wellness.
Yes, we did,
and then we went into more about health challenges, about what are the struggles people have. What are the common diseases that people go through? Then we talked about stress in depth. We talked about nutrition, how food plays an important role in building your health, in healing you as a person, and what are the other modalities of things that impact you. So we covered a lot in the first 3 episodes, and it all led to today's episode where we talked about exercise, where we talked about movement, where we talked about injuries, where we talked about performance. So we talked about the well performance optimization and the exercise part of it today. Of course, not to take the focus out of exercise. Exercise. One thing I forgot to mention in the course of today's episode was the mood boosting effects of exercise.
Oh yes,
the mental
important.
health benefits of exercise. A lot of research has gone into exercise on how it impacts your endorphin levels, your hormonal levels, and how it brings up your energy and your mood. So that element is a plus bonus to the metabolic effects of exercise. So I guess we've covered a lot of things. Do check out the earlier episodes. There's tons of amazing discussions out there. We intend to make it available on all our social media feeds.
Yes, it
And
is.
do check us out.
Yep. Remember, you can check out all the videos. We got 4 episodes of Health Ready with Dr. Reddy. And, do check out our social media, especially on Facebook, which is fb.com/Health Ready Show. We got some exciting news coming, in the next few months. So you got to watch out for it.
Yeah, and more importantly, if you have questions, post them on our social media feeds, and we would love to address them. We would love to give you more resources. We will keep you updated on the latest research, the latest trends, and so look out for the space.
Okay. Maybe you'd like to, at this moment, share some acknowledgement to those people who made it possible for us.
Yes, definitely. So for me, I would like to thank mainly my team. I had a wonderful team to work with here. All the technicians, all the my friends behind the scenes, without whom this is not possible. Water, amazing host. I would like to thank Active SG and Sports SG for the amazing support that they've rendered. I would like to thank Andrew John Harrison, who's been a mentor, who's guided me in my own health and wellness journey. I would like to thank my partner, Dr. Tiffany Yo, without whom I don't think I will be able to stay out so late. I would like to thank all my clients and patients who have helped them. They've been amazing teachers for me. They've been supportive. They've been very nurturing in my own learning journey. And last but not the least, I would like to thank all my audiences and you guys for your attention and for your amazing support.
Okay. Likewise, I would like to firstly thank Sport SG together with Active SG for supporting this show. All right, they have been wonderful. Also, the crew, okay, if I may, okay, quickly rattle off their names. Co-producer Stephen Hu, we've got our cameraman Albert together with Leo, okay, who's manning the visuals and everything else. Rama, who's like coming in to direct the whole show. Limping, manning the time right now. Also, okay, our back end, we have got Ronald, who's been busy editing all the shows for all of us. Also, special shout out to the 4 guests that we have. So we started with Jerry Toh, Ross Sapani, Max Tay, and today Dr. Christina Liew. Likewise, I also like to thank, the studios. Very important, okay, the 2 studios that we have shot in. We started off with Just Renla, okay, where we shot 3 episodes, and today this amazing White Studio, okay, the White Dojo. Thank you very much. And like you, okay, a very special person I'd like to thank for getting me on this health journey. It's transformed my life, not as on my health basis, but also mentally, emotionally, and made me a better leader. Okay, thank you very much, Andrew John Harrison from GoZone. Thank you very much. All right, like I say, it's gonna be a wrap for all of us. Okay, so thank you very much for the very last time. And again, this is not a goodbye. We hope to see you soon. My name is Wadate.
And I'm Dr. Sankit Reddy.
Okay, see you soon.
See you soon.